Hey everyone, this is John Mullins. At Marshall Lifestyle Medicine and with our executive health program, we spend a lot of emphasis on the prevention of disease. We know that most disease that manifests in the United States and worldwide is completely controllable with lifestyle decision making, which is why we call our practice Marshall Lifestyle Medicine. However, today's discussion, we're going to talk a little bit more about early detection, because even when individuals are doing everything properly and they're following guidelines and they're eating right, they're exercising, they're sleeping, they're avoiding tobacco and they're drinking in moderation, there are still instances where statistics and the unfortunate nature of statistics, still there are people that develop early cancers and early disease that needs to be detected as early as possible to avoid the sequela that can occur with a late diagnosis. So today I'm fortunate to be in the presence of somebody from the Galleri test company called GRAIL. I was fortunate enough to have her fly in this morning from Philadelphia. Her name's Lara Bagby, and she is here today to help us understand the importance of and the information associated with early detection of cancers. And so I'm glad to have you with us today. Thank you for joining us. Before we get started, why don't you just tell us a little bit about yourself, your background, a little bit about your story and how you came to be sitting with me today.
Sure. Thank you so much for having me. It's a pleasure to be here. My name, as you said, is Lara Bagby. I am a field medical director at GRAIL, and so I sit in medical affairs, and our job is primarily to provide medical education. I've been with the company for about 3 years, and I came to GRAIL through the way of the prenatal space. Mm-hmm. I was a prenatal genetic counselor when a test called non-invasive prenatal testing was developed, and that ended up leading me to this path of being in medical affairs and with the company with GRAIL.
Okay, that sounds great. Well, we thank you for taking the time to fly into Lexington. I hope you have a good experience while here. I think our listening audience is very big on doing everything they can within their own power to prevent disease. I think they're equally interested in some of the advanced diagnostics that we oftentimes talk about and try to promote as part of our executive physical program, executive health program. And today, I'm glad we're going to have an opportunity to talk about the ways by which cancer can be detected more early, in particular with the use of the Galleri tests. I think this is a good segue. Can you just tell us a little bit about GRAIL, about Galleri, and how it works, the science behind it, and anything else you would like to add?
So GRAIL's mission is to detect cancer early when it can be cured.
Sure. And
it was actually founded in 2016 after an incidental finding was discovered in the prenatal space. So in our former parent company ran a test called non-invasive prenatal testing, and that's a blood test that you do on pregnant women to screen for genetic abnormalities in the pregnancy. And in 2015, there was an article in the Journal of the American Medical Association where they followed about 10 women out of 125,000 who had very abnormal non-invasive prenatal testing results. And the follow-up studies on their fetuses found typically developing fetuses, but the women were actually diagnosed with cancer because what they were picking up in that non-invasive prenatal testing was abnormal DNA from cancer. And these women had different types of cancer, and so it was kind of like an aha moment, like we could use one single biomarker to screen for many different types of cancer. And so what we're hoping to do and what we'd like to do is work with physicians and patients to advance the way we do screening for cancer in this country. And also, and as this technology advances and improves it, we want to partner with physicians alike.
It was always fascinating to me as a doctor, particularly since I've been in this field, was the we only screen for about 5 types of cancer, period. Mm-hmm. And we put a lot of emphasis on breast cancer, skin cancer, colon cancer, cervical cancer, prostate cancer for men, and zero emphasis on the rest of them. And I was always found that mind-boggling. The people that were undergoing their preventive test screenings, which they should still do, that we miss 60, 70, 80 other types of cancer that we had no capacity to test for at all until they were identified, oftentimes late stage, because they were asymptomatic, right?
That's right. Yes. It's about 70% of cancers have no recommended screenings whatsoever. And so as you alluded to, we are often not finding these cancers until symptoms and signs appear. And often those are at later stages.
Or they're just incidentally found.
Correct.
We do a CAT scan on someone's abdomen because we think they have a kidney stone. This just happened, by the way, in our practice. And they had a stage 4 kidney cancer that just was sitting there and had been growing for years because they're slow growing. Well, that was why when the representative from your company came to our practice several years ago and was presenting the information, we knew that this was something that we had to adopt for our patient population, particularly because they are so health-minded and they really want to know if they're doing the right things. And if, God forbid, something were to be brewing inside them, they want to know sooner rather than later so that they can make proactive steps to deal with it more effectively. So it sounds like that's what you're saying. The Galleri test allows for that.
That's right. And by utilizing cell-free DNA, and as I mentioned, they used this blood test to screen for genetic abnormalities in fetuses. Well, cell-free DNA, everyone has cell-free DNA, but when you have something in your body like cancer, that produces a different DNA pattern that we can detect when we draw the blood.
Go into that. We have a lot of nerds that watch this stuff. I mean, we have some people that surprisingly would do a lot of research after this is all. So you're picking up on the free cell DNA that is there present even in people without cancer, but the DNA signature for people with cancer is different.
That's correct.
And that's what you're detecting.
And that's what we're detecting. And we're looking for a signature that's common across many different types of cancer. So we're not doing multiple tests within that one blood sample. We're doing, one test that looks for this shared cancer signal across multiple types of cancer at once.
Then how do you hone down into the individual cancer organ types?
Yes, so we're looking at methylation patterns. Methyl groups sit on the outside of the DNA and it controls the genes that are turned off and on within different cell types.
Epigenetics.
Epigenetics, exactly. And so your signature for colon cancer is different than your signature, say, for pancreatic cancer. So we can look at these methyl groups and say, yes, we're seeing an abnormal pattern, and it's most likely to be occurring in the colon or the pancreas or the lung, etc.
We do a lot of other epigenetic testing for our patients that we try to monitor how lifestyle changes affect their DNA expression epigenetically. Often myself included, and most doctors, we always believed that most things that affect us or affect our patients are truly genetic based. So that's interesting. I didn't know that that's what the Galleri test, that it was checking for methylation patterns. I think our listening audience will understand that principle because many of them watch other podcasts and they're familiar with methylation patterns and methylation testing. So yeah, that's fantastic. So tell us a little bit more about the utility. What is the typical age that you recommend a person considering having this kind of testing done?
The Galleri test is recommended for asymptomatic individuals who are at increased risk for cancer, like those who are over the age of 50. Age is our biggest risk factor for cancer. And so that's always has to be at the top of mind. Like, okay, are you over the age of 50? Yes, you're at increased risk for cancer. And so that's really who the Galleri test is geared for. But we do know that other individuals who may have other risk factors that could increase the likelihood that they could be developing cancer, that's higher than other people their age.
Sure.
So people who have a personal history of cancer, family history of cancer, that could predispose them. And so they may be at high enough risk to also consider Galleri.
Well, we just changed the colon cancer screening to 45, and I've heard that they may even consider going down to 40. There is a higher incidence, at least anecdotally from my perspective, and I think statistics would bear that out, that cancer is becoming more prevalent in younger patient populations. So even though, just like heart disease, the number one determinant for risk for heart disease is age, But there are other people that develop heart disease. I've seen them as an ER doctor that have heart attacks in their 30s, in their 40s, and I think it does need to be personalized somewhat.
Absolutely. And to your point, the American Cancer Society actually put out in 2025 this trend that we're seeing cancer diagnoses at younger ages. And that's something for us to keep in mind. But we also need to be looking at those preventable risk factors, modifiable risk factors like alcohol use, UV exposure, things like that.
Yeah. And we do risk stratify in our office. We tend to attract very health-minded people that we even use the Galleri test as part of our executive physical. And I would probably entertain having that on anyone that was older than 40 that was going through our executive physical, because I still think there's some statistical data that would suggest that there are a subset of those that even if it's a greater than zero chance of having cancer in that age group. Which leads me to my next question. I guess most people would want to know about statistics like the accuracy, the sensitivity, specifics. And so would you mind talking a little bit about how the test has been, from your statistical perspective, what type of data you've accumulated with respect to those kind of things?
Sure. So based on our clinical validation studies, specificity is 99.5%. So that means that 1 in 200 people who don't have cancer would get a red flag through this test. And it's just a red flag. It says, you know what, we're more concerned that you could have cancer, and it bears a diagnostic evaluation. So the Galleri test can't say yes or no that you have cancer. It's a screening test. It says we should be more concerned
but
or
it's
less
very
concerned.
highly specific.
It's very specific.
Very,
exactly.
very specific in the sense that there is very few people that get a positive test that will be ultimately negative. Am I saying that right?
So it's so people who don't have cancer, it's very few of people who don't have cancer that they would get a red flag through this test.
There you go. So it's not like we're scaring the bejesus out of a lot of people unnecessarily.
Correct.
How about the sensitivity side?
So the sensitivity, it depends on the type of cancer. If the person has cancer, it depends on the type of cancer that they have. The Galleri test does not identify all cancers. And so depending on the aggressiveness of the cancer, how well it sheds cell-free DNA into the bloodstream, that's going to determine the sensitivity for the test.
Okay.
Thankfully, most people don't have cancer, and so most people will end up getting a negative test result, and that will be reassuring for them.
I just had a CT cardiac calcium score test because I had a very strong family history of heart disease, and fortunately my test was negative, which gave me great relief, because I was still of the opinion that because my grandparents had heart disease and my father had heart disease, that it was predetermined that I was. And again, it was an epigenetic thing. My score was negative. It was 0. So I like peace of mind testing personally. And I think a lot of the patients that come to me are also looking for that validation that what they're doing is good and that they have a clean bill of health, at least for today, and they can move forward with that, continue having that positive affirmation.
That's right.
What else would you like to talk to about with respect to the Galleri? Any special patient populations that we've talked that would benefit from testing? I think before the podcast, we talked a little bit about firefighters a little bit. Yes,
firefighters, because of all the exposures that they have, especially if they've been in years of service, then as they get to be, again, 50 or older, they may be at increased risk for cancer. And so some practices offer the Galleri test to their firefighters.
We have a first responder hero program when we see a lot of firefighters. We do have a fair amount that have put in their 20-year tenure and that are getting ready to exit the profession. And I think I'm going to be a little bit more aggressive with talking to them about this particular test for them.
Sure.
And that was information I did not know. I knew it was available, but I think in light of what you've shared with me, I think I'm going to be a little bit more purposeful about discussing that with them.
Yes, and I think that you bring up a good point in that the firefighters who have only been in the business for a couple of years, their risk is not significantly higher than other 20 to 30-year-olds, but as they accumulate risk over time from those exposures, that's when they really need to be thinking about that.
I think the take-home is, and I believe that all patient care should be personalized and collaborative. You do have to make personalized decisions that and each person's somewhat different with their ability to handle risk, and what the need for affirmation associated with positive testing and negative testing. So we try to take a collaborative approach when we're talking with people.
That's right. And it has to be that shared decision making. Patients, there are patients who really want to know all of this information. And then and it really comes down to, how will this change their care, and is this information that will be helpful to them? Some patients are like, absolutely. Other patients are a little bit more hesitant to embark on screening tests, and so you'll know your patients well enough to make that decision with them.
Well, unfortunately, the people that make it through our doors are like that already. Why would I want to know that? Why would I want to know that information? All it would do is scare me. I just don't think they're quite ready yet to know what that they're better not knowing. And I wish it wasn't like that. And I guess that's up to us having these types of podcasts and these educational type of seminars, so that the people understand that early detection is key to all disease, not just cancer, all disease. And there are simple tests. I don't think your test is even that expensive for the amount of information that you garner from it, the value add associated with it. I think it's fair.
And what we find is that if you are diagnosing cancers in these early stages, then the 5-year survival rate is 89% versus only 21% if you're diagnosing it after it's metastasized. And so if we're able to detect it early, there's a higher likelihood that for a successful treatment, more treatment options, and better overall outcomes.
As I'm preparing for our executive health physical rollout, I've had to put together a lot of information statistical for the powers that be that would be making these decisions on behalf of their patients. If you can catch it early, it costs less, your survival rate increases, and people just really need to be able to factor that kind of stuff into their decision making. Most of what we spend in the United States is on late stage disease manifestation. 80-90% of our healthcare dollars goes towards the chronic treatment of chronic disease or late cancer treatments that we can prolong someone's life, a little bit at great cost, and oftentimes great disability to them. So I'm a big advocate of catching things early and then dealing with it swiftly.
Absolutely.
Okay, well, I think we could all agree to that. Is there anything else you'd like our listening audience to know? Anything that's coming down the pike that maybe that isn't related to GRAIL or Galleri, that's something you've heard of, or anything you're personally interested in the longevity early detection space?
One thing that I'm very excited about is next year, our randomized control trial that's being run through the National Health Services in the UK, that will be read out next year. And the primary endpoint of that is to see stage shift, so that we see a shift in the stage that we are diagnosing cancers. And so I'm really looking forward to that readout, and hopefully that will lead to showing the clinical utility that insurers would like to see.
We're right. And that is where we are as a society, is we have to collect enough data to move the needle from the model that we are all accustomed to currently, which is reactive. Wait till people get sick and then react to it aggressively, to more of a mindset that there's high value in early detection. Prevention doesn't cost hardly anything to do. Early detection, it does have a fee associated with it, but it's a lesser of a fee than the ultimate treatment for something later stage. And then you mentioned the survivability. We just got to collect data that's compelling enough to change the powers that be.
Yes.
So that insurance would consider this a reimbursable test that it isn't currently.
Right. And
that's unfortunate, but not unexpected. The wheels of medicine move very slowly. Oftentimes way slow, and unfortunately for the patients, it's unbearably slow. But I think we are making good progress, and I can't wait to read that data myself.
Yes.
So. Okay. Well, I wanted to personally thank you for coming. Thank you for taking the time out of your busy schedule to come. We have a fairly large audience that will be listening to this. I guess for the people that are listening in, Marshall Lifestyle Medicine, we perform that test currently in any one of our 5 offices and also online with our Marshall Connect, our nationwide virtual office. And we're going to be including it in our executive physical for folks that are coming in just for a quick evaluation as to kind of ascertain where their baseline is. So you're welcome to call and inquire about that test with either me personally, any one of our office staff, or any of our other providers, and we'll be happy to assist you with not only getting the test, but the interpretation of the test results, which is most important. So thank you for joining us. I really appreciate your participation, and thank you everybody for listening. Please stay in touch. If there's anything I can do, please don't hesitate to reach out to me. Thank you, everyone.